I know I met with a group of your board members and Susan and Gail, and we had a very good kind of informal conversation, I'll call it that conversation, about an open dialogue and collaboration. I am very supportive of that. And one of the things that I've been doing with the nursing home industry is meeting with the corporations and having meetings with the nursing home association leadership and with corporation leadership, their CEOs, president, CEO, however they're set up, and really talking about that corporation's vision, their mission, expanding opportunities in Florida, better ways that we, from regulators, can understand what type of provider they are, what services are they offering that may be, unique to their association or organization. So I want to open that up to you as well, and I know Susan and I talked about getting together and doing that once we got through session, and then now we're in hurricane season, right? You know how that goes. But that is one thing I want us to do when Susan gets time and I get time, when we can coordinate our schedules a little bit and start doing that. I really do want us to have that open dialogue with you. I know that when my surveyors come into your facilities, we don't always agree, right? Right. We really don't. Yeah. We don't. We might as well just be open about it. We don't. We don't agree all the time. Some of the times we do agree. You will say, you know what, absolutely, we could have done a better job there. Your staff were right. Sometimes we get it wrong. We admit to that. Nobody's perfect. We do admit to that. We have opportunities for you, if you do not agree, what you can do. We have come on site to your facility and we find a deficiency, you don't agree with it, don't argue with the surveyor. I know you may not agree with them. They've given you an opportunity, or you've had that opportunity to talk about it, and they're leaving your facility. You don't argue with them about it at that point. Reach out to the field office. I have 8 field offices in the state. Do all of you know who your field office manager is? Absolutely. If you don't know who that is in your area, stop me on my way out of the door today and I'll be happy to tell you. Reach out to that local field office manager. Again, we don't always get it right too. One thing I want to make sure is that when we do write a deficiency that we are right. And if we aren't right, let's remedy that situation. Even if you feel like you haven't been heard and you want to reach directly out to me, that's fine. I have my contact information here. If you want to reach out to Susan or Gail, they know how to track me down, so they can do that as well. But that is really something we want to do. And one of the reason why I want to do that is whatever we post on our agency's website, I want to make sure is correct, because we are very transparent and we don't want to post something that's incorrect. We have done that in the past, and we'll remove it from our website. But again, that goes to us opening those doors up and having that open conversation and collaboration. So again, thank you for allowing me to be here. I understand our new secretary is coming tomorrow. So I guess I'm gonna have to watch what I say today, not say anything off color, because somebody in here will tell on me. So I'll have to play it straight. But a couple things I'm going to talk about today. You'll enjoy the secretary. Have any of you met our new secretary? I knew you had, Doug Atkins. You probably, first day she started, you probably showed up at her door, didn't you? I wasn't even in town. I didn't meet her for like weeks. All of you probably met her before I had an opportunity, because I'm out and about. She's very nice, very approachable, has a very open mind of how a different way of doing business. It's kind of a breath of fresh air, I think, because she's thinking outside the box. Those of us that have been in government for a very long time, you get stuck in that rut. You probably do in your corporations. That's the way we've always done it. You probably say that yourself. Well, that's the way we always have done it. Why change it now? But it is nice to have that type of leadership now to say, well, wait a minute, maybe that's the way we've always done it, but is that the best way that we can do it? And so that's what's really nice about her. So we're going to talk about today, the biggest thing I always end up having to talk about are deficiencies that we're seeing. Talk about a little bit of deficiency trends. Comprehensive emergency management, we can't seem to get away from that. Probably when I retire, I will definitely stop talking about comprehensive emergency management plans when I retire. So let's go over a little bit of statistics. One of the things I do know is that your organization, you're really our larger facilities, our larger assisted living facilities. So just wanted to give you a little bit of statistics. And I know your organization does a good job of pushing information out to you, but as of July 5th, these are the number of licensed facilities, ALFs we have in the state, over 3,000, and we're pretty consistent at being over 3,000 in the state of Florida. As you'll see here, over 105,000 licensed beds. Majority, as you know, you've been in this industry a long time, you know the majority of our beds, majority of our facilities are 6 beds or fewer. Anybody know where the most concentration of those smaller facilities are? South Florida, in the Miami area, you're right. Miami, Broward area, those are where we have the most. Now, 25 to 150 beds, we have 896. Again, that was as of July 5th. And over 150 beds, we have 95 assisted living facilities in the state that fall into that category. How many of you fall into that over 150 beds? How many of you have some of our larger facilities? Okay. So that's just a little bit of statistics, and at any point in time, anybody want any of this type of specific information, just reach out. It's public information, just takes us running a little report, and we can get it out to you. So the top ALF deficiencies that we're seeing in the state. So I want to talk a little bit about those. And what I concentrated on, because I got my marching orders from Susan and Gail, is instead of looking at the top 10, and historically, whenever I've spoken to your organization, or any of my staff have spoken to your organization, you be standing in the front so you can take my picture with it? Yeah. I gotcha. I don't want my picture taken. One of the things we've always done is look at it from a statewide perspective. So everybody, and I mentioned this a few minutes ago, the most number of beds we have is our 6-bedders, and where they are concentrated. So one of the things that Gail and Susan said, can you break it down by beds? 25 and plus is where you guys fall in. So we wanted to pull these out specifically for you to kind of talk about what we've seen in 2018, and I have some statistics for you of what we've seen so far in 2019. Now, the first couple of here, our staffing standards, our training staff, our in-services, resident care, and that A0030, kind of our resident rights tag. As you know, over time, we've just kind of seen that go up and down, and that's, again, with all of our 3,000 plus ALFs. We've seen this one go kind of at our top on down, but that does hover there in the top 5. Resident care supervision, that's where we mainly cite elopements. And we've seen increases in elopements in assisted living facilities around the state, maybe not in your larger organizations, but definitely in our small 6 beds. Physical plant, safe living environment, that's something that we is still kind of in our top 5 there. A0181, emergency plan approval. I'm sure you all know we are being very vigilant in reviewing your compliance with that requirement. We're having an approved comprehensive emergency management plan. Down from 7 through 10 here, we're looking at our admissions criteria, continued residency, background screening. And don't y'all remember the days where background screening was number 1 and number 2? Mm-hmm. Y'all remember that? Yeah. Thank the Lord, we've done a lot of work on that, right? And we will continue to make great strides moving forward. And it is nice when somebody who looks at this kind of data pretty routinely to see that there are some areas that we really have improved on. And you have to pat yourselves on the back. I think you guys have done a good job across the board with being very vigilant and aggressive and making sure you're in compliance with that requirement. Admissions, that health assessment, and then rounding it out is that medication and assistance with self-administration of medication. So this is what we were looking at last year. In 2018, these were our top 10 deficiencies. So brace yourself when we go into what we've been seeing lately. So this is what we've been seeing from January 1st of 2019 to now. As you'll see, Still, that staff banking service, as you know, that was their number 2 last year in 2018. Now it's moved up to number 1. But look what's crept up there for us. Yep, our emergency environmental control. We're going to talk a little bit more about that tag as I go through and some things that we're actually seeing when we're out there. Resident care, we talked about that earlier, kind of that resident rights tag, our staffing standards, resident care supervision. Again, that's always in our top 5. The biggest thing we are seeing lately, again, is elopements. Medication, self-administration of medication. And what's interesting for me, I don't know if you've noticed what's crept into our top 10, A0093, food service dietary standards. That's a little interesting. That's the first time I've seen that. And maybe it's just unique to 25 and plus beds. I don't know, but I did find that very interesting. Training, do not resuscitate. We're seeing some of that. That's in our top 10 here during 2019. Admissions, and then our emergency plan approval, our comprehensive emergency need approval, and then our background screening clearinghouse. So at least we got our background screening clearinghouse. Again, that was number 7 or 8 in 2018. Now it's moved down to that 10th most cited tag that we are seeing for 2019 so far. So I want to go over a little bit, kind of some examples of what we are seeing with some of these regulations. A0081, I get all confused with all these. And our tag numbers for ALS is different from any other provider tag. I have to know all this stuff. People should feel sorry for me, shouldn't they? It's hard to keep up with all this. In 2 weeks, I'm doing a session for all the home health agency providers. Home health agencies, that's a totally different ballgame too, but it's all kind of runs together after a while. A0081 staff and service training. Any staff who provide that direct contact with residents must receive that 1 hour of in-service on infection control, including universal precautions, facility sanitation processes before providing care. Our nurses, CNAs, home health aides are exempt from that training because they have additional training for their licensure or certification requirements. And then all our trainings must be complete within 30 days. And a facility staff must demonstrate an understanding and competency in the implementation of elopement response policies and procedures. I just want to draw your attention to that for a few minutes. As I mentioned, we've seen a lot of elopements and deficiencies related to elopements. And it's important that your staff know what your policies and procedures are. And I know it's a constant battle, educating and re-educating your staff, but it is very important because when we do a survey, we're going to talk to your staff. We're going to talk to your residents naturally, but we are going to talk to your staff. And if we're doing an investigation about elopement, we're going to ask to see your policy. We're also going to ask to see, and we're also going to ask your staff to see if they're aware of your policy. So keep that in mind so that when we come on site, you know what we're looking for. Some of the other things that we've cited in 2019 for this specific tag relates to training for abuse neglect. We're seeing some errors in that. ADLs, incident reports, adverse incident training, and resident rights. So those are some of the training areas or in-service areas that we are not seeing provided to your staff for the requirements in the regulation. So that's that tag. A0200, our emergency environmental control. So let's talk about this for just a little bit. I know you probably get tired of talking about environmental emergency management, right? Susan's shaking her head, she knows. Because I know too, I'm talking about it. The acquisition of sufficient alternate power, such as a generator, maintained at that assisted living facility. Air temperatures maintained at or below 81 degrees or Fahrenheit at 81 degrees for a minimum of 96 hours. That's part of that requirement. Sufficient fuel, 72 hours for our 17 plus beds, bringing additional on-site to achieve that 96 hours upon declaration of emergency. And we do know, and I think we've been talking about this since the rule, since the emergency rule, and then since the adoption of the final rule, that we know that there are some restrictions locally, but then you must replenish within 24 hours prior to depletion. The acquisition of services to maintain and test the equipment and functions to ensure safe operation. We do expect, one of the questions I get periodically in an assisted living facility is, excuse me, is, are my staff out testing the generator? No, we aren't, right? My staff aren't asking you to turn your generators on, are they?
Yes.
My staff are not. If they are, they shouldn't be doing that. Now, that lies with you. That's your responsibility to make sure that you know how to operate in a safe and sufficient operation of your generator. That's your requirement. Now, nursing, if you're part of a larger organization, nursing homes are different. They follow a different set of rules and regulations, and they have the life safety code requirements that we enforce. Their generator requirements, I know we have the state ones, we also have things that are federal for nursing homes and also life safety, and they are required to test the generator. That's part of what my life safety surveyors do is actually have them test the generator. Must be sure of maintenance of that carbon monoxide alarm. I think in the beginning there was a lot of confusion about how many carbon monoxide detectors do you have to have. I think the rule is very clear. It just says carbon monoxide alarm or detector, and that's it. Ignore this. That was an error. Just ignore that. Sometimes that happens. Submission of plan to your emergency management agency for review and approval. Hopefully that you've recognized this, that new facilities will receive a provisional license pending approval. Susan, you knew we were doing this, right? Okay, good. So we know that there's a lot of folks involved in approval of your plans. And we know that some of the county folks, they have their requirements that they like to follow. They want us to enforce their requirements, but we can't do that. We can only enforce what we have the authority to enforce. So what we are doing is still coming on site to do your initial survey. If all your other requirements are met, we are coming on site to do your initial survey. Pending approval of that, you are issued a provisional license until you get your plan approved. Have any fallen into this category? Have you had that with any of your facilities? Okay. And that is something that we just started, can't remember the exact date, but a couple of months ago we did start that. So again, so that you can open your business and start your assisted living facility, yet still protect residents when you admit them, and under that provisional license status. Approved plans, maintain a copy that's readily available at the licensee's physical address for review. So what do you think readily available means? That's right, not locked up in the office or in the trunk of your car. That happened before. So the rule actually says ability to immediately produce the plan, either in electronic or paper format upon request. Now, believe it or not, may not be any of you in this room, but believe it or not, we have gone on site to do surveys, and guess what? Nobody has a copy of the plan. Nobody has a copy. It may be locked up somewhere. Nobody has a key, but maybe the owner or the administrator. Or it may be in somebody's trunk of their car, Lord knows where. Or it may be at somebody's house. May not be actually at the licensed facility. So it is important that a copy of your approved plan is there. I know recently I've had conversations with my staff in facilities that are larger than 25 beds. When we've had some situations and we've gone on site to monitor, and I said, well, what is the facility's plan? Do we have a plan? And they were like, Kim, we're asking them for the plan, and nobody can seem to find the plan. Now, we all know this is something we're looking at, right? We're looking at that. We're going to be asking you every time we come on site to look at your plan. So make sure you have it available. Make sure your staff know. You know, your staff are the ones that are there. They're providing the care and services. There's an emergency, they need to know. And we're not sitting around waiting for a hurricane to happen, right? We have things happen all the time in Florida. I mean, as we just mentioned when I walked in, we have the water main break down in Broward County. We are reaching out to the facilities, but first and foremost, what do we expect? We expect facilities to be in compliance, and we expect facilities to follow their plans. They have those plans, and they're approved by the county for a reason, so that you have a guide. You put something in place that's unique to your facility. There's no one size fits all. That's unique to your facility for you to follow in situations like this. We have facilities that are struck by lightning. Their power goes out. We get alerts. Somebody's calling the media. That happens all the time, right? Somebody's calling the media, and we go on site. They call in the media, we're going to go on site. Whenever you see yourself in the newspaper, guess what? We're probably going to show up. It's just a little tip for you. We're going to be asked. We're going to be asked. But it's important that your staff know, because I can tell you, no matter what that situation is, whether it's a lightning strike that blew out your power, you're running on a generator, or you have no AC, you may have power. You know, it's Florida. People's AC units go out, right? I had an employee that sent me an email this morning. My AC is out, and I'm home waiting on my AC guy to come and fix it. She has to have a whole new unit. So, I mean, things like that happen. You know, you got to be prepared for when those things do happen. So when we come on site, we're going to ask you, what's your plan? What's your plan? Do your staff know? Because we're going to ask your staff that as well. So it is important that that plan is readily available. And communication is very key. I think sometimes that, and this is something that, a misnomer that we have to deal with community folks, consumers, and with the media, is that they think that we know when something happens in your facility that we know right away. We don't, do we? We don't know. If something happens to somebody in surgery at a hospital and it's an egregious event, people think that we know right away. We don't know. We don't know unless people tell us. So it's important, if you have something that happens at your facility, and I tell all provider types this, you have something that happens at your facility. Say you are struck by lightning and you lose power, or your AC goes out, or something else happens. You have a flood. You know, you have all of a sudden your septic tank or your sewer system is backing up in your facility. We've had that happen in a hospital. No lie, happened in a hospital. It's important for you to communicate with us. Pick up the telephone, send an email, call your local field office. Again, if you don't know who that is, ask me. I'll tell you. If you want to send me an email or call me, absolutely. I actually had an ALF provider not too long ago call me on the weekend. She was like, oh my gosh, you answered your phone. I said, well, I got it with me. I know it was her. She called me on the phone to tell me something had happened in their facility. She said, I didn't know who to report it to. I called the office. There wasn't a way for me to leave a message. So I had your information. I called you. I thanked her as I was like, oh my gosh, thank you. Because it's very important, because guess what? The next day, there was a clip it was a news article about that specific facility. So guess what I said when I was asked? Absolutely. So-and-so called me yesterday. They called me on a Saturday. It was in the newspaper on a Sunday. I said, absolutely. Because the biggest thing they want to know is is the agency aware? I said, absolutely. The agency was aware. One person at the agency was aware, but the agency was aware. And I was able to say that. So our response was, yes, the agency is aware, and we're reviewing the situation. So I did. I think that administrator, she was, apologized to me for bothering me on the weekend, but that doesn't matter. What matters is that you're letting us know and that your residents are safe. Because that's one of the first things she said. Our residents are fine. This is what we're doing. I said, thank you so much. And really, honestly, that's what it's about. We can communicate all we want, on a global level. And I can talk to Susan every day of the week. But it's important that you also are having this ongoing communication locally with your managers too, so that they know if something happens in your facility. We've had horrible situations in facilities too, murder, suicides. That happens, unfortunately, with our population, right? Sometimes that happens. Let us know. Doesn't mean we're going to come running in. As a matter of fact, we're gonna stay out because we know there's a healing process that has to happen. And we've had that in one of our nursing homes, not too long ago. So, you know, keep that in mind. It's all about us communicating with each other.
Can I ask a question about the provisional license? That is only until the environmental control plan is approved, right? Not the SEM.
Yeah, there are provisions in our law that we can approve a provisional license for up to 180 days. That's in the law, and has historically been done for a change of ownership, but we decided to implement it here because of the delays. So yeah, essentially it could be up to 180 days, but part of that process goes back to that ongoing communication is once you get your plan, is that you're communicating with the office so we know.
But it's just for the environmental control plan, not the SEM, right?
It's just for your EVP.
Thank you.
Okay, so implementation of the plan, I think that everybody's very familiar with this. As you know, we do have many assisted living facilities that are still operating under that approved extension. We know that some did expire in January. There've been some review and some extensions being granted, and variances are being issued by the agency. Some of the things that we did, you may realize this or know this, prior to right before hurricane season, we did have some facilities, and we kind of prioritized those facilities. We had facilities that, assisted living facilities, believe it or not, that never reported anything to our agency. We reached out to them by phone, they never responded to us. And those facilities we visited, we did priority list, and those were visited pretty quickly. We went out to see those facilities. And facilities that had an extension that expired, then those facilities, and we hadn't heard back from them, those facilities we went out to visit as well. So we have been doing a lot of visits. We had over 400 plus facilities, assisted living facilities, that were still, again, kind of operating under that extension, or we just didn't hear from. So we've made a lot of visits to assisted living facilities. And part of our visit was, hey, you haven't responded to us, but also we were making sure that although you may have an extension or your extension expired or your variance expired and you're waiting on our agency to respond to your request for an extension, you still have to arrange for safe temperatures. You don't get off the hook. We don't waive the requirement altogether. We want you to arrange for safe temperatures, have an alternate power source on site or contract for delivery within 24 hours of an emergency, evacuate if in an evacuation zone. This doesn't supersede any evacuation orders. So those are some of the things that when we came on site, we were looking at. And we're still finishing up some of those visits. Our goal was to have them done before July 1st, but we were only given this directive kind of in May. So we had a lot we had to look at, and we still are kind of, as I said, going through those. But as of right now, well, actually, as of yesterday, July 17th, there are 548 assisted living facilities with no current variants in place. 2,408 have a plan approved and implemented, and then 216 have a current variance. So those 448, that falls into some of the categories that we're actually going on site to visit now. As you know, prior to July 1st, your extensions were sent to Department of Elder Affairs, and we did have some that were not approved prior to that July 1st date, when Department of Elder Affairs, when the rule authority for assisted living facilities moved over to the agency. So there are some that we are still working on that were not processed over at DOEA. So we are trying to work on those and get caught up. So that's a part of that 548. But we are working through those. And if you do fall into that category that you're waiting on us to get back in touch with you, or you haven't heard anything from us, feel free to reach out, because our goal is 100% compliance naturally. So policies and procedures. One of the things that we do look at is the policies and procedures. And we want to ensure that your staff can effectively and immediately activate, operate, and maintain the alternate power source and fuel. Again, that's your responsibility. I know some of your larger organizations, you probably have maintenance man, right? That's their job. You want to make sure that they know what their job is and that they know how to operate that equipment. They know how to safely operate and handle your generators. Additionally, ensure that residents do not experience complications from fluctuations in air temperatures. This must be included in your policy and procedure. Must address the care of residents occupying that facility during that declared state of emergency. You need to, bottom line, we want you to take care of your residents. That's the foremost thing that we want you to make sure that you're doing is taking care of your residents and having effective policies and procedures in place. A lot of the deficiencies that we have written related to the emergency power plan are regarding policies and procedures. The facility not having policies and procedures in place that address these points here that I just talked about. Your staff not being aware what your policies and procedures are, or being educated on your policies and procedures. So it is very important that you make sure you developed good policies and procedures that are realistic, operationalized, and that you train your staff on. That's very important. As you know, and unfortunately, we do have some providers that are failing to come into compliance with these regulations. So we are taking some very aggressive action. Bottom line, our agency wants 100% compliance. Wouldn't that be nice, right? It'd be nice if everybody was in compliance. We'd all just have a great week or a great year. All be great. That doesn't always happen, but that is our expectation. Every time we talk to county officials, and unfortunately I actually had to go to Broward County last week. Any of you, and I know you mentioned some of you do have facilities in Broward County. I actually met with the state attorney in Broward County and an organization called Bold Justice. Those of you in Broward County, you're familiar with them? Yeah. So I met with them. It was about 60 of them and the state attorney and me. Just a little old me. So, but we had a good little conversation about our facilities, our nursing homes in Broward County and assisted living facilities that have variances or don't really have anything. So I kind of explained to them about, the rural authority moving over to AHCA and kind of where we are with some of those delays. But I did stress to them, as I'm stressing to you, we do take it very seriously, and we will fine, and that's probably the first thing that we will do. We'll fine a facility for failing to be in compliance, and if not, we'll take more aggressive action, such as revocation. Now, I know this is a smaller facility, but I do want to kind of give you an example of what we've seen when we have been out there. We have been at several of these facilities doing our generator visits, and I know this is a small facility, but it's an example for you to think about. We've gone on site to a facility and we've asked about their generator. My staff have asked about their generator. They had a portable generator. We saw it on a truck bed, and this facility owner had 3 other assisted living facilities in the area. So then we went to another one of their facilities, and guess what? We saw the same one. And then we saw the same generator at another assisted living facility. This provider has on more than one occasion provided misinformation to the agency, and then actually did not tell the truth to my surveyors when they were on site. So again, I said this person owned, I think, 3 assisted living facilities. So we went on site, this is what happened, and then we wrote deficiencies, some very serious and egregious deficiencies, and we are moving for revocation of that operator's license. So because of our language, our statutory language and authority, if you have controlling interest in another facility type that we regulate, we also will go after that licensed entity as well. or that's part of our requirements. So that's what will happen. So just to let you know, I know it's a smaller facility, it doesn't fall into the 25 plus beds, but it is an example of what we are seeing out there. So just wanted to share with you, how serious the agency is about holding facilities accountable and making sure that you're in compliance with these requirements. Every time I talk about regulations, no matter if it's these regulations or other regulations, I always say, I don't make the rules up, I just have to enforce them. And that's what we're out there doing. Our legislature found it fit to enact these rules and requirements for us. And so that's what we're going on site to do, to make sure that you're in compliance and holding you accountable for those regulations. So notification, and you all know, you gonna be stopped for just a second?
Yes.
Absolutely.
So everybody's gonna take a quick 5-minute break. Y'all try to get resituated in, move forward some, because again, we turn this into a 2-part session. So as much as you can, scoot in, scoot up.